Hi, everybody. We're going to move on now to Unit 4. So we're going to talk about reflective practice, reflective journals, critical thinking, and journal styles. This is often a topic when students kind of push back and say, oh, reflective practice sounds so boring, but it's actually a very important part of your professional practice. And I think it's part of just being a human being to reflect back on what we've done, what we've said, how we've impacted other people, and just to learn to actually how we can do things better. So reflection is what allows us to learn from our experiences. It's an assessment of where we have been and where we want to go next. So we're going to talk about critical thinking, define reflective practice, discuss differences between free write and reference journal articles in this PowerPoint presentation. But what is critical thinking? Well, it's an active, organized cognitive process used to carefully examine one's thinking and the thinking of others. And we do it all the time. Thinking beyond what is said and or shown, like looking beyond, reading between the lines, considers options related to information. How else can you actually do something? Is this the only way it can be done, or are there other better ways that we can do it? You're going to hear, oh gosh, you probably won't hear it as much as when you're student now, but as when I was a student, it was like, we do it this way because it's always the way. We've always done it this way. No evidence-based practice back then. And I used to think, really? Is that true? Anyways, history has shown that things change. Now we do it the way because that's the best way. If it's evidence-based practice. Critical thinking evaluates and makes decisions based on sources of information. So how are you going to back up what you're actually thinking? The goal of critical thinking is not to devise a single solution, but rather to envision a number of scenarios that could occur and could work depending on what actions you're going to be taking or not taking. And you're going to run into situations probably on a daily basis where there could be alternative actions you could have done, but you choose the one that's best for that circumstance. And that's critical thinking. It's also an analytical process. It's purposeful thinking to make complex decisions. It's a self-regulating process of interpretation. So you're interpreting what's happening, you're analyzing the data that's given to you, and then you're evaluating how you're going to act and inference. It helps you to identify and analyze assumptions and evidence to recognize emergent client situations and make clear, objective, clinical interventions and intervene appropriately. It helps you with your practice. To evaluate in a reasoned and unbiased way what you hear, read, or observe in order to judge its validity or worth. People who are not critical thinkers often just, obedient. They're generally obedient. They just do what they're told to do or do what they're asked to do, neither considering the consequences of their actions or alternatives. So I want you to think about, do you do exactly what you're told, or do you think about it first? What questions do you ask yourself? Why do they want me to do this? How will this affect my patient? How will not doing this affect my patients? Are there any alternatives that might be better for my patients? If you use any of these kind of questions in your mind when you're asked to do something, you actually then are a critical thinker. So questions a critical thinker might ask. So what's happening? You gather the basic information. You look around you and you see what's happening. Gather the information. What's important? So now, what is significant about the information you've gathered? And what don't I see? What information is missing? Do I have all the pieces of the puzzle or don't I? How do I know? So ask yourself where this information came from. Is it a credible source? Is it not a credible source? Is it, again, one of those things that I was told, we just do it this way because it's always been done this way? Who is saying it? Do you value the person who's actually giving you the information? Is it an evidence-based research paper? Are they done by, is the process that's been scientific, sorry, I'm having trouble with my words here, scientific evaluation? Is it a credible source? And what else? What else are you missing? Are there other ideas that exist that you could draw into this scenario that might help you? So why do you have to be a critical thinker? Well, you are going to manage complex situations. You're going to be put in situations that are going to require you to think outside the box and become a critical thinker. It ensures holistic, client-centered care. Ensures best client care possible. You've looked at all the alternatives that are available. You have chosen the best one for your client at that time, given the information you have. And it allows us to learn from successes and failures. And you're going to find you're going to do something and you're going to look back and go, wow, was that really the best way I could have done that? What other ways could I have done to actually made that better? So I'll just give you a scenario. When I was a fresh grad nursing, and I was working on a medical floor, and I had a patient who had been in a motorcycle accident, and his dressings, honest to God, took me an hour and a half to do because they were so extensive, and I had to pick out the dirt and grit from his dressings. Anyway, so I went to bed. That was at night, and I've gone to bed, and I'm thinking, and I'm actually dreaming about how I can speed up the process of doing his dressings. And I got it. So I had kind of reflected back without knowing it, that I reflected back on his dressings, and I cut the time in half to how I was going to do his dressing. So, I mean, we all are going to look back on our practice and to see how we can do things better. We all have the ability to be critical thinkers, to look at a situation deeper, to ask more complex questions. And it'll get easier, I promise. As you do it more often, it gets easier. So you are a critical thinker if you explore underlying thinking and assumptions, base judgments on facts and reasoning, not just because we've always done it that way. Suspend judgment until you have all the data. Everybody's given you their piece. Supports view with evidence, and evidence-based practice now is extremely important. Evaluate the credibility of sources. Turn mistakes into learning experiences. Even a med error, it's a learning experience. How could I have ensured that I didn't make that mistake? Ask why not, how, what, and be open to other possibilities. So reflection. Reflection starts as part of this process. So the process of purposefully thinking back or recalling a situation to discover its purpose or meaning. We all do it. And like I've said already, it can be as simple as looking back at a conversation you've had with another student if it didn't go well. So what could you have done to actually had a better outcome? That's reflection. It's necessary for self-evaluation and improvement. Sorry, I've left nursing practice in there. Not nursing, of all of our practice. That was my mistake, sorry. But why does it matter? Effective communication requires an understanding of how an individual affects those around them and how those people affect the individuals. We don't operate in a vacuum. What we do affects everyone around us. So how can we ensure that what we're doing has the most positive impact on those around us? And that's reflecting back on what we've done. So how do we know what we're missing if we don't seek it out? Looking back. What would you want to know if your actions would you want to know if your actions negatively impacted a client? For sure, I would. Are we always sure every action we take in the clinical setting is the best course of action for the client? There are times, and trust me, that I've looked back and thought, could I have done better? Clients and superiors will not always tell you when you screw up. Sometimes it isn't until you've screwed up massively or so consistently they can't bear it anymore that you hear from them what the problem is. Reflecting back on your practice helps you to catch your problems before they impact others too strongly. It also helps you to live in a happier existence because it can make you aware of when you need a break or when stress is becoming too much for you to handle. It's really important. But what does it involve? Examining attitudes and reactions, not just yours, but those of everybody around you. Revealing negative emotional responses like inadequacy, fear, vulnerability. Looking back, how did you feel about doing that procedure? Were you a little anxious? What could you have done to actually decrease your anxiety? Allows for resolution of these causes, changing thoughts and behaviors. Bridges the gap between theory and practice. We already discussed, some of you in the Unit 1's forum. Sometimes there's a huge gap between the ideal that you learn in theory and reality as it is in practice. So how do you bridge that gap? Achieve self-awareness and highlights limitations and strengths. Again, learning. So reflective practice, I want you to just kind of think about what types of thinking have you done today? As an example, I started my day off deciding whether to get up straight away when the alarm went off, or do I push the snooze button and stay in bed for an extra 10, 15, 20 minutes. But then, how would this impact the rest of my day? Because I have to get off to work. Will I have time to get dressed? Probably not. So now I need to get out of bed. So we think all day long. So just think about what kind of thinking you do. There are six aspects to reflective learning. 1, a sense of inner discomfort triggered. So described as knowing there's something you must do but can't remember what. Number 2, identification of concern. This is where the nature of the problem becomes evident. This is what distinguishes reflective learning from other cognitive activities. 3, openness to new information. This is external, internal sources, the ability to take in a variety of perspectives. It's the hallmark on reflection. So you're looking outside for more help. Resolution or aha moment. One feels they have learned something or changed and it's personally significant. You've made a difference in yourself. Change in oneself comes from internalization of a new perspective. Number 6, decision whether to act on an outcome. This is decision making and problem solving. So did you actually do it and make it work? Developing reflective skills for critical thinking. So we do this by learning to do reflective journal writing. These journals are a tool for developing critical thinking and reflection skills. They help you to define and express clinical experience in your words and allow you to look back on a situation. How did you act? What could you have done differently? What knowledge could you have used? What could you have done differently to better impact the outcome of what happened? Requires dedication and desire to grow. I believe we all do this type of reflective thinking daily. All now you're going to be asked to do is to write it down and look at it more critically. Reflective journals help you to find meaning in your clinical experience, make connections between those experiences, draw from past experiences where similar situations and take in, did what you did for that situation, did it work? Could you try that now in this new situation? Gain values of the healthcare profession. Learn about the perspectives of others. Call on your colleagues and ask them how they would do something for a particular situation. Reflect on professional roles. Develop writing and thinking skills. And learn to care for yourself. This course is going to ask you to look at 2 types of reflective journals, a free write journal and a reference journal. So reference journals are goal-directed, seeks to connect learning experience to theory and literature, as well as stated learning outcomes. Includes relevant references, course text, peer-reviewed journal articles. So you're going to look at a situation that you're reflecting back on, and you're going to draw in the evidence-based practice to support what you did do or what you could have done in the future. So you could be looking at anything, and I can't even come up with an example right now, but you're going to use evidence-based practice to support your decision. And then we have free write journals. So reflect on clinical experience, re-examine them, and improve your behaviors and responses within the clinical environment. These are writing from the heart. You don't have to back these up with evidence-based information, just from the heart. You write exactly what happened, what you felt, and it's just to put it on paper and reflect back on it and what you think you could have done to make it better. Do I need to do something or should I just leave it alone? These are the questions going to be going through your brain. So reflective practice. What do I sense, feel? How might this seem to others, especially the patient? Do I need to change something? Critical thinking. Are there risks here? What do we know about the circumstances? How do we achieve desired outcomes? Reflective practice and critical thinking go hand in hand. And one typically doesn't happen without the other. So I want you to just, be aware of reflective thinking, keep it with you, and use it in your practice. And I still use it, and I graduated 30 years ago. And that's the end of Unit 4. So now on to Unit 5.